Good evening, everyone. I hope I am audible. Can you just quickly confirm that the audio and video is fine? And if it is fine, we will start this session, which is very, very close to my heart. And that is how to crack an exam in your first attempt and in 1 year of your preparation. So just give me a quick, a quick thumbs up whether the audio and video is fine, and we can then talk about this topic. And I'm sure that this will be an absolutely worth time for all of you, specifically those who are preparing or thinking that they want to get a rank in NEET PG 2025. I just wanted to emphasize that this session is specifically for the students who are aiming for a rank in November INICT or NEET PG 2025, not for mid-year May INICT or the June NEET PG exam. Okay. Yeah, good evening, Ratika. Okay, so before I talk about the topic, okay, just let me just tell you what I'm planning to do. Is this is a session that I'm planning to do, that how to crack NEET PG 2025 in first attempt. Now, what is the meaning of this word first attempt? For different students, this means different. Mostly, I will say that the students who in northern part of India, they consider first attempt is an attempt with the internship, and in the southern part of the India, they consider the first attempt as after the internship. So my idea of first attempt is the attempt in which you do your complete 1 year of dedicated preparation. It could be during internship or it could be after the internship. Whichever it is, that session is gonna be there, and I'm telling you this is gonna be a very, very useful session for all of you. So before I start talking about the session, can I just get a quick idea that what kind of students are listening to me? Are you an intern or are you a post intern? Now, why I need to ask you this is that the big difference between intern and a post intern is that if you are in internship, irrespective whether the internship is light or you have to do a lot of work, still the amount of time that you're gonna have will be slightly lesser in comparison to the student who has already completed the internship and are dedicating your one complete year for the preparation. So I just wanted to have a brief idea about that. What are you considering it as a first attempt during your internship, or you are a post intern? So anybody who can quickly write it and let me know, and then probably I'm gonna take it forward from there. Yes, I'm just waiting for any answer, an intern or a post intern, anybody, so that I can just take it forward. I have got some doubts from the students already, and on the basis of those doubts, I have already prepared some of the questions as well. And if you want me to add some more questions, I'm gonna add some more questions. So these are the questions that I am gonna plan to take up with you in this session. So the first topic or first question that I'm gonna take is, I don't think I'm intelligent enough to crack this exam. What to do? The second question that I'm gonna take is, how should I utilize this time to get best out of it? The third question that I'm gonna take would be, how many hours do I need to study in a day? Fourth that I'm gonna take is, how to prepare 20th notebook. What should I do if I haven't made one? The next question that I'm gonna take would be, how should I revise and how should I do last minute revision? There are some topics which are very, very close to my heart. The one is how to mark the answer in an MCQ paper if you do not know the right answer. Then another topic that I'm gonna take is, how many GT I should write. How many questions should I attempt in the NEET or an INICT exam? And the question is not relevant for you, but you're gonna realize the importance of this. I want all of you should have this sweet confusion that got a rank, what next, radio or orthopedics? So and I'm telling you, this is a very, very big confusion, but let's hope that you all come to that great confusion, and so-called the very, very great confusion, that you have got a rank now when you have an option to choose. So what to choose? All right. So apart from this, if you think that is there anything else that is needed, to let me know that, and I will try to incorporate that particular question also in this session. Any other question, or if you think that I need to omit any question, then do let me know. I can omit also. A lot of times it's difficult. Sometimes students have the doubt, but they do not want to put it into the comment section. You can send it to me on my telegram group, or you can send it on the DBMCI telegram group, or I mean, you can directly send it to me also. And you can send it to me on my Insta handle, and I will try to give you the answer for that. Okay, or the best is you can just put it in a comment section. So let us go one by one. For those who do not know me, or just let me give you a brief, then who am I to tell you about this particular part. My name is Dr. Rajat Jain, and I did my MBBS from Maulana Azad Medical College, and then an MD in radio diagnosis from Maulana Azad Medical College. And then after that, I did senior residency. I was for a brief time a faculty in Maulana Azad Medical College for radiology, and guiding and mentoring students. Now it's been almost 18 years that mentoring student. By the grace of God, when I appeared for the exam, I was able to get some decent ranks, and some of the notable rank include the first rank in a Delhi postgraduate medical entrance exam in 2007. So and since I did it from Maulana Azad Medical College, the internship at my time was again, as usual, a hectic one, and I was able to crack the exam along with the internship. So now let us talk about all these points, and that is what I am gonna talk about is mostly my experiences that I did during my preparation time, and how to utilize it. Okay, so let us go one by one, and let us go with the first question. The first question is, I don't think I'm intelligent enough to crack this exam. What to do? I'm telling you that this has been a very, very common doubt, whether you will believe it or not, that this thought and this doubt is gonna come to your mind. Presently, almost 220,000 people, in fact, more than that, are writing the exam. And in order to get into a branch of your choice and into a college of your choice, you need to score really, really well. And if you want to get a government seat and a clinical subject, you need to be in top 10,000. And if you need to be in top 10,000 out of that cream of 220,000, it's a very, very common thought to come to your mind that I don't think I'm intelligent enough to crack this exam. What to do? All right. So whenever somebody asks me this particular question, it broadly tells me that there is nothing actually called as intelligence. Everything is based on these three words. And if somebody asks me what are these three words, I will say, if you want to crack an exam, what you have to do is very, very simple. Just give me a second. So if you want to crack the exam, what you have to do is simply what is called as PhD. And you have to do the PhD, and everybody use this. What are you doing a PhD in that? So what is PhD according to me? And PhD is perseverance, hard work, and discipline. This is what is PhD according to me. Perseverance, hard work, and discipline. If you can get these three things in your life, take my words, you can achieve anything that you want. Now, what does that mean? Now, it reminds me of this young woman. Anybody who knows who is she? Anybody who knows who is she? Her name is Arunima Sinha. Whenever somebody says that it's too difficult to achieve this particular task, I am not capable of doing this particular task, I always think of this, Arunima Sinha. Now, Arunima Sinha is receiving a President Appreciation Award from then President Honorable Abul Kalam Azad sir, and she was receiving it. Now, see, this is one of another of her photo. She was receiving it. She was a Indian women's sports player. Now, Indian women sports player, we know the sports in India. Now, thanks to the changing environment in our country, otherwise, few years back, the only sports that the people were aware of is men's cricket. Now, thanks that now people are aware about the women's cricket also. But Indian women sports player, people do not recognize it very often. Arunima Sinha met with an accident where she fell from a train and she lost one of her limb. And when an inquiry was conducted, the result of the inquiry was that she tried to commit a suicide, but she said a different story. She said that few people were trying to snatch a chain from her, and as a result of which, when she tried to resist, people threw her out of the train. And I mean, when then she told the story to the other people, people thought that no, she is a failure in the life, and that is why she is doing it. So, in order to prove herself, she climbed Mount Everest with one limb. For me, this is one of the biggest story that has always pushed me that I can do whatever that I want in the life. Do you know why? I live on a fifth floor in an apartment, and if the lift doesn't work, I don't climb 5 stairs to come to my apartment. I wait so that the lift comes and so that I can go up. And she climbed Mount Everest with one limb, and by the grace of God, I have got the two functional limbs, and still I am scared of climbing 10-15 stairs, and I wait for some assistance in that. And she climbed Mount Everest with one limb. Imagine when she can climb Mount Everest with one limb, you are just talking about cracking a postgraduate medical entrance exam. A postgraduate medical entrance exam, it is not even a task. It can be very easily done. Very easily done. But I am telling you, what matters is your thought process. What matters is the correct set of guidance. What matters is your perseverance, your will to do that hard work, and the most important word is discipline. Is discipline. I always believe that if you have will to win, half of your battle is won. If you don't, half is lost. So you have to have that will. Then, along with that will, you need to maintain that discipline for an year. You should be ready to do that hard work and this perseverance that yes, you are doing the same thing again and again. There will be a time that will come when you'll feel like giving up. This will happen more with those students who are intern, because once you are in internship, you will be doing an hectic duty, and it's after hectic duty you have to study also. You will feel like giving up. The number of episodes of feeling like giving up are gonna be more for an intern than a student who has completed the internship and writing the exam. I am telling you. But take my words that if you have followed perseverance, hard work, and discipline, you are getting a rank without a confusion. You are 100% getting a rank. Take this me from in writing. Okay, so that you can definitely do this. But now the big question is, how should I utilize this time to get best out of it? So first, sit and identify that how much time you have. Please remember, you cannot compare yourself with anybody else. You know your circumstances. Every person is unique. I am unique. You are unique. Second person who is your friend who is sitting with you is unique. You have your own challenges in the life. Some of you will be having, you if even if you're an intern, you have a challenge of internship. If you're a post intern, you might be having a challenge of having some financial goal to take care for your family, for yourself. If you are financially well off, if you have those balances maintained with you, you might have some another challenge that is waiting for you, and that challenge might be a completely unique challenge. Some of you might have got married and still want to crack the exam. Some of you might be having kid and you still want to crack the exam. Now, whatever stage in life you are, but I am telling you, you can crack the exam with 1 year of hard work. So the first thing is that sit alone, talk to yourself, and ask that how much time that you have, and according to that, identify the resources that you have to do. Okay. Now, before I go to the resources, now first I wanted to show you something. When we were preparing for exam, our biggest challenge was non-availability of resources, and the knowledge was limited to certain section of society, certain set of colleges. Nowadays, the problem is different. The problem is too many resources. This is a very, very big problem. Too many options. And do you know, I feel that we were lucky one that we had limited resources. You have a much, much bigger problem, because the biggest thing that you get is this fear of missing out. Today I am making this video and I'm gonna telling you that you have to read this, and you will say, oh, sir has produced result, I have to do this. Now you're gonna listen to another video and that person is gonna say that you have to do this, and then you're thinking, oh my god, this is also important, that person has also produced a result. And then third person is gonna come and they're gonna give you their own strategy, and then they will say, oh, you will not do this, then this is gonna happen, you're not gonna do this, is gonna happen. So this is a much bigger challenge, in spite of all of us being absolutely honest in what we are telling. Why? Because this is what we have followed, this is what we have seen that the people have followed. But that does not mean that the second person has followed a different route and that person cannot get a rank. So you know that this person is talking honestly, another person is also talking. It is not like that one person is not talking correctly and the other person. It is about their way of perceiving the things. But that confuses you as a student. That confuses you that what you should do. So this is a very, very big challenge. So I'm going to try to address all this, that what to do with too many resources, what to do with too many options, what to do with FOMO. All right. So I have done an exercise for you. And what is that exercise? Now please see this. This is an exercise. This is what my senior told me. And I did it, and I recommend it to every student who is preparing for the exam. Please remember, if you are preparing for a PG entrance exam, it is different in comparison to when you are learning the subject. Now we have a focused thought, and that focused thought is, I have to appear in a competitive exam and I have to get a rank which is better than others. So if you want to get a rank better than others, you have to develop a strategy. And the strategy has to be a targeted strategy, that what is a target that you're looking for. We have got two exams. These two exams are NEET and INI-CT exam. And these are the two exams. The total number of questions as per the current pattern that we get is 200 in both the exams. 200 in NEET and 200 in INI-CT. On the basis of previous year papers, this is what I have done. I have done the bifurcation, that the approximate number of questions that are asked from a particular subject. Now, somebody will say, sir, what are you saying? Only 10 questions are asked from the anatomy. Nahi bache. So nowadays, what we get are integrated questions. So every question has a part of another subject also. Now you don't get question from a subject, you get a question from a disease, you get a question from a topic. Now let us say you get a question on Wallenberg syndrome or a lateral medullary syndrome. Let's take an example. Now if you get a lateral medullary syndrome, a question on a lateral medullary syndrome, that can be solved on the basis of your anatomy knowledge. So an anatomy teacher will always say that this question is asked from their subject. And this can be solved on the basis of your radiology knowledge also. And this can also be solved on the basis of your medicine knowledge also. So the question belongs to anatomy, radiology, medicine. And that is why lot of time you're gonna see that the different people will tell that more number of questions are asked from their subject. So because if you're gonna calculate it like this, the number of questions are not 200, the number of questions will be 500. And the moment I'm going to say number of questions will be 500, this will become 25 questions from the anatomy. This will become 20 questions from the physiology, depending on the overlap of a particular subject that you have with another subject. All right. So that is how you have to take it. You are not supposed to take it. So we are talking about the exclusivity of the question. All right. So anatomy 10, physiology 10, biochemistry 10, patho 15, micro 10, pharmac 10, FM 5, community medicine 15, ENT 5, ophthal 10, medicine 20, surgery 20, OBG 20, pediatric 10, ortho 5, 5, 5, 5, and I have added radiology as a 10 question because of obviously a bias that I feel that every question is from the radiology. But this is a broad division that I have done, and using the previous year questions, I have done the same division for the INI-CT. And that's the same division that has been done for the INI-CT. But the third very, very important part that I did for this is, now, if you see to it, that everybody is talking about this term which is called as PYQ. PYQ. And we commonly called it as a previous year topic, not question. And a previous year topic or a previous year question. Okay, so if somebody asks me that what is the percentage of repeat, okay, so the percentage of repeat for a previous year topic is very, very high. But even for the question also, now real direct repeats are nowadays, I will say, very, very less. But a slight improvisation of the question and then repeat, and a difficult question from the same topic. Let me say, let me give you a topic: TB. Tuberculosis will be asked in the exam. Tuberculosis will definitely be asked in the exam. There is no doubt about it. Somebody say breast cancer. Breast cancer will be asked in the exam. Carcinoma cervix. Carcinoma cervix will be asked in the exam. But how closely it was to the question that was asked in the past? Was it a direct repeat, or was it just a slight improvisation of the question that has been asked? That is what I have done. So on the basis of that, I have created another list for it, that what is the broad percentage that we get a repeat. Okay, and that is what I'm going to share, this this hard work that I have done for that particular subject. And on the basis of that, I have broadly identified that what are the areas and what are the hard work that I have to do with that particular subject. And then I have limited, or I have identified the resources that I have to follow. Okay, now before I go forward, now what I'm going to do is, now I'm going to again divide myself. As I told you, every person is unique. I'm going to divide myself into two groups. The first group is a student who has started their preparation already when you were an MBBS student, what we call as a foundation student. And those are the students who have attended foundation classes somewhere. Okay, foundation classes somewhere. I'm not necessarily gonna say that you have attended foundation classes at DBMCI. You have attended foundation classes at your own. You have attended a foundation class, or you have learned the subject well during your MBBS, solved some of the MCQs either by reading from an app, or by attending some online classes, or by attending an offline class. But the net result is you have your 19 subject notes available. You have your 19 subjects notes available to you. Okay, now if you have this, I am telling you, you are already one notch above than other people. You are one notch above than the other people, and you are in your internship. You are in your internship. Sir, can I crack the exam? Answer is 100%. Can I crack the exam with a very good rank? Answer is yes, if you follow PhD. Every time I'm going to use this word: perseverance, hard work, and discipline. Your 50% of the job is already done. You have already decided the content that you have to read, and that is what you have prepared. Now, a lot of people will say, no, this notes is not good, this note is bad. As an institute also, I'm gonna come and say, अरे नहीं नहीं, ये सर्जरी यहाँ से पढ़ लिया, ये तो खराब हो, ये तो बेकार हो गया, अरे नहीं नहीं, यहाँ से पढ़ लिया नहीं. एक बार अगर आपने अपने 19 सब्जेक्ट के नोट्स बना लिए, और ड्यूरिंग दैट टाइम यू वर कंफर्टेबल विद दैट नोट्स, वी गोना यूज देम एज अ बेसिक. Ideally, if you have done questions also once, that's an icing on the cake. But if you have not done that, this is absolutely okay. Absolutely okay. My usual suggestion to you in this case, please do not think that this is a video to promote a course. My usual advice to you is join a live, please remember, structured TND program. Join a live structured TND program. Now, what is the meaning of a structured TND program? A structured TND program means that you have a test on a specific date and followed by the discussion. it does not mean that you have an access of a test and discussion. You should have a structured T&D program which tells you that on this particular date you have this subject, on this particular date you will have this particular subject, and what you are doing is you are reading that subject before coming to the class, you are attempting that test, and you are doing that discussion. We all have done that, and I am telling you, if you are aiming for a rank in top 100, this is an ideal plan for you. But for those who have already made their notes during their foundation classes, anywhere, this is an ideal program for you. Now, since it's a DBMCI platform, I have to speak slightly about the institute also. DBMCI has T&D programs which have been known for top ranks, so you can try a DBMCI T&D program also. That does not mean that's an only program that is available. Look at your feasibility, look at your choices, and according to that do. But if you are selecting a T&D program, definitely go through a DBMCI T&D program. Take reference from your seniors also, those who have been ever a part, that whether it was of any use to them or not, and I'm very sure that you're gonna get a comfortable response from them. It's gonna be very useful. Now, what is the biggest challenge that you're gonna face here? Now, you will be doing an internship. You will be depending on a college that you have. Some will have a hectic medicine posting, some will have a hectic surgery posting, some will have a hectic OBG posting, some will have a hectic pediatric posting. Now, you're gonna give up during those times. This is gonna be a big challenge. But please do not skip tests. Do not push yourself कि चलो recorded version available है, which is available at most of the places nowadays. I'm gonna do it later. The more you gonna finish the things at a given amount of time, the better it is gonna be for your preparation. Any student who goes into this circle of backlog is going away from PhD, है ना? अब देखो PhD में क्या है? P is perseverance. That means same thing has to be done again and again. And with a discipline, the structure will give you a discipline. I have to write a medicine test today. I have to write it today. I will not change my schedule. Take my words. Anybody who's gonna genuinely guide you is gonna definitely tell you this particular statement, that you have to finish the things in a given amount of time. In a given amount of time. Nobody will disagree with me, irrespective the person belongs to which area. 100%, be it your senior, be it your any guide. So this is an ideal plan for you. Make your own chart like this. If you cannot make it, take my help and use this particular part, and that is going to be very useful for you. Okay. Now, most of the time, 1 year is more than sufficient to get a rank, provided you identify that what you have to follow. The biggest challenge happens with those students who keep on thinking कि चलो मैं ये कर लेता हूँ, चलो मैं ये कर लेता हूँ, चलो मैं ये कर लेता हूँ. Okay, so this is what you have to do. Okay, now how many hours do I need to study in a day? Now this is a question that I feel that I need to answer. I feel that identify your time, and whatever time that you can take out should be dedicated to studies. Please remember, 1 year is very hard for you. Take my words as a senior. This PG medical entrance exam preparation is considered to be one of the most stressful period in a medico's life. Never ever you have worked so hard. Never ever you gonna work so hard. So this is one of the most stressful period for your life. I can tell you, I am available for all of you to, if you think that I can help you in any way, I will try my level best to guide you, to support you, to mentor you, and whatever help that you need. But there is one thing that I expect from all of you, that in this year you are doing this, which is eat, sleep, read, repeat. Eat, sleep, read, repeat. If you are a post intern. If you are an intern, obviously there are added responsibilities. If you have a financial compulsion and you have to do a job, you can do a job, but try to get your finances settled as early as possible so that you can dedicatedly study as much as possible. Okay, now you will earn 3 lakh rupees extra in this particular year, but as a result of which you had to waste one more year is not gonna be useful, dear. It is not gonna be useful. So try to balance. Now there could be a challenge. There could be a challenge that you are the only earning member in your family and your family was waiting for it. So that's okay. Then try to create a balance on that particular scenario. But apart from those compulsory hours, if you are really dedicated, if you are ready to do that PhD, eat, sleep, read, repeat. And that is something that you have to do. Okay. But now let us come to the much, much bigger aspect of our session today. And that is how you can get a rank. Okay. How you can get a rank. So now what are the challenges that you're going to face? Now, before I go on to the next point, I just wanted to tell you, see what happens. Now, what you have to do, there is very simple aspect. 200 questions are gonna be asked in the exam. Okay, the rule is very simple. More number of topic, more close to the exam you will read, better will be your rank. Now what will happen? You will read a subject. The rule is very simple. Read theory. Okay, read theory, solve MCQs. Read theory, solve MCQs, write GT, and repeat this cycle. That's all. So this is the simplest principle that you have to do. But what you have to do with every stage as you are going close to the exam, with every stage that you are going, your amount of content that you are reading should keep on getting decreased. Should keep on getting decreased. Okay. So now let's say I am doing my first reading in around 6 to 7 months. My second reading should be in 2 to 3 months. My third reading, if the time permits, should be in one month, and my next reading should be in 10 to 15 days, something like this. If you have done something 3 to 4 times, you are sorted. But now how you gonna do that? And this is done by what is called as consolidation. This is done by what is called as consolidation. This is done by something what is called as smart study. Now, what is the meaning of the word smart study? The smart study is that you are spending more time onto the topics which are more commonly asked in the exam, and you are spending less time onto the topics which are less likely to be asked in the exam. And this can be easily understood by what is called as Pareto's principle. What is that Pareto's principle? Pareto's principle is called as 20-80 rule. 20-80 rule. Now, what is the 20-80 rule? 20-80 rule says that 80% of the questions will be asked from 20% of the topic, and 20% of the questions will be asked from 80% of the topic. There are total 100% questions, and there are total 100% of the topics. There are total 100% of the question, there are total 100% of the topic. So 80% of the question will be asked from the 20% of the topic, and 20% of the question will be asked from the 80% of the topic. So the rule is that if you want to prepare, first you have to master these 20% of the topic, and those who have mastered this 20% of the topic are already getting a rank. And once you have already decided sure that you are getting a rank, then we're gonna try to cover this component of it. But please remember, I am not gonna cover this without covering this 20%. And what is this 20%? I mean, this is much more than that, but this 20% is definitely covered in 3 things. This 20% is definitely covered in these 3 things. What are these? These are your notes that you have prepared from anywhere, previous year questions or topics, and GTs. So this is the simplest principle of getting a rank. Notes, previous year questions, and GTs. And this has to be done as many times as you can. And slowly as your GT score will be improving, you will be doing this 80%. A lot of time people ask me, yes sir, you are saying this, but I have seen that interview of the rank 1 or a rank 2, but he has read I do not know what all he has read, because he was already crossed this 20%, and after that there is no limit on to going to this 80%. Okay, so now what you have to do is, now you have to read, and every time you have to identify that what are the things which are more likely to be asked in the exam. Now this is the second thing that I'm gonna tell you. Now, what is the most likely asked thing in an exam? For every subject, remember this. For every subject, remember, these are the things that is gonna be asked in the exam. The first thing that will be asked in the exam is update in a subject. Whenever there is an update in a subject, whenever there is a new guideline that has come up, this is more likely to be asked in the exam. Whenever there is a topic in general discussion, whenever there is a topic in general discussion, like for example, we are talking a lot about carcinoma cervix nowadays, we are talking a lot about TB, we are talking a lot about HPV vaccine, we are talking about HPV vaccine, carcinoma cervix, TB. For the last 2-3 years, we are talking about COVID. So whenever there is a topic in the news, this topic is gonna be there in the paper, because this is not a news for you. This is news for the person also who is making your paper. Okay. Update is not for you. Update is for a subject expert also who is making your paper. Okay. Exceptions. MCQ papers are signs of exception. Whenever there is an exception, this is more likely to be asked in the paper. More likely to be asked in the paper. Differences between two diseases. Differences between two diseases. You are reading a subject and you come across differences between two diseases. Whenever there is a table which is demarcating the differences between two diseases, it is always likely to be asked in the paper. Always likely to be asked in a paper. Differences between two diseases. Okay. Life saving event. Anything that can save the life of the patient, or life destroying event. A life saving event or a life destroying event. Okay. If there is a life saving event, you think that as a doctor, if you're gonna do this, you will save the life. This should not be performed in this particular patient. A patient of a urethral trauma has come, and you know that in a patient with urethral trauma, you should not do a Foley's catheterization. A patient of cardiac pacemaker has come, and you know that in a patient with cardiac pacemaker, you should not do an MRI. So life saving or a life destroying event is always a very, very important area that the examiner wants to target. Next. A common misconception about your subject. A common misconception in the subject. Now, what is the commonest example of a common misconception in a subject? When I was an MBBS student, I used to think that if a patient has a hip replacement, its MRI of the patient cannot be done. If a patient has a hip replacement, now I cannot send the patient for an MRI examination. Now just tell me, how many of you think that this statement that I have said is true? If a patient has a hip replacement, I cannot perform an MRI of the patient. True or false? If a patient has a hip replacement, I cannot perform an MRI of this particular patient. True or false? Shobi, I'm gonna talk about this bache in a while. Okay, I'm going in an order. So please remember, when I became a radiologist, I realized that how wrong I was. You can easily perform an MRI in a patient who has an orthopedic implant, because majority of the orthopedic implants are made up of titanium, and titanium is compatible with MR. So now I want to ask this question in a PG entrance exam, because I want that the younger generation, people who are coming up, should not do this particular mistake of not sending a patient for an MRI because they have a wrong knowledge during the undergraduation. So the point to be noted is a common misconception about your subject is always an area where the examiner asks it. Okay, so now if you want to look at it, these are the focused areas that the examiner asks. Now what I'm going to do, whenever I am reading a subject, a teacher will be teaching me a lot of stuff, including the concepts, including the fundamental. All those are important, but those concepts, those fundamentals I have learned, I will remember it. But all these aspects of the subject, I'm going to write it separately. I'm going to write it separately. If you say that you have a notes of 200 pages of a particular subject, these things that I have written, they're going to come in 20 to 30 pages. They're going to come in 20 to 30 pages. And do you know what is this called as? This is called as this, which is called as your 20th notebook. This is what is called as 20th notebook. I am telling you that there are a lot of people who ask me this, sir, what is this? How to prepare the 20th notebook? This is something that you have to write in your 20th notebook, and this notebook you're gonna be revising in your last 10 to 15 days of your preparation. This is something that you're going to be revising in your last 10 to 15 days of your preparation, and there are a lot of chances that a lot of factual stuff is going to be there in this particular part, and there are a lot of chances that you will be able to recall it very, very easily. So when should you start preparing your 20th notebook? When should you start preparing your 20th notebook? What is the answer? The answer is from day 1 of your preparation. From day 1 of your preparation. The earlier you start, the better you're gonna become in this particular aspect. Okay, so that's what I wanted to tell you. Okay, now the moment you start consolidating the things like this, I am telling you, you will be sorted. Okay, if you are a post intern and you have not studied well during your MBBS, which is a usual scenario for more than 80 to 90% of the student, my standard recommendation to everyone is try to join a structured program. Try to join a structured program, and this structured program is an ideal face-to-face classes if they are available in your city. If a face-to-face class is available in your city, that is an ideal way for a preparation, because that will bring more discipline in your preparation. Please remember, the biggest area for which I am worried is the D of the PhD, and that is discipline. Because the moment this is gonna come, P and H will automatically come. The moment D will come, P and H will automatically come. The biggest challenge is this discipline, and the discipline comes with a structured program. And the best way to get a structured program, again, nobody can differ from it, is the face-to-face classes. You will have to study. You are sitting in the class, you do not have an option but to study. You do not have an option to get distracted from a social media or from a mobile phone. You have to study, you will study. But there could be a challenge that you are an introvert person. In your city, the classes are not available. Your parents are not allowing you to go from one city to another city to attend the classes and to live there. There are different problems that you are facing. Then my suggestion is join face online live classes. Online live classes. Again, the whole idea about this is again a structured program. Again, a structured program. The discipline in a live class will be lesser in comparison to the face-to-face classes, but something is still better than nothing. You cannot compare the discipline of a face-to-face class with any other mode, but online live classes can serve a purpose. Okay, can serve a purpose. Again, at DBMCI, we have an option of face-to-face classes almost in every part of India. Delhi to Bangalore to Hyderabad to Kerala to Tamil Nadu to Calcutta to Mumbai to Ahmedabad. Now, with most of the cities are being covered. In case you have a challenge, online live classes are also available. Okay, but the whole idea is you should have a structured program. You should definitely have a structured program, because what I want in your preparation is discipline, and this discipline is definitely needed in your preparation. Okay. Acha. Now, sometime you have to develop a lot of ways to prepare. Lot of ways to prepare. Sometime what happens is that in spite of your best efforts, you are unable to remember it. So now, if you are in a structured program, you need not to bother it. Now, I'll give you certain example. Let me give you some very simple examples. Let me take an example of this question. Can anybody help me out and tell me that what is an answer of this question? Concept of village health guide is given by which committee? Concept of village health guide is given by which committee? Can anybody tell me what is the answer? If I give you the choices, let's say Srivastav committee, Boer committee, Jangalwala committee, Srivastav committee, Boer committee, Jangalwala committee, Kartar Singh committee, what is your answer? Concept of village health guide is given by which committee? Okay. So always remember that whenever you are preparing, whenever you are studying, you will come across two kinds of thing. One is a conceptual thing, one is a factual thing. Concept stays with you because there is a why behind it. Whenever you have learned a why behind it, it will be very easy for you to remember that why. But for a lot of things, there is no why. So my idea is very simple. Either there has to be a logic. If there is no logic, you have to create the logic. Either there has to be a logic. If there is no logic, you have to create the logic. So like, for example, I'm going to create the logic. The concept of village health guide committee is given by a committee. I don't remember the name, but I know that there was a person by the name of Srivastav. Srivastav used to live in villages. And Srivastav, just the name says, it looks like that he lives in village. तो श्रीवास्तव गांव में रहता था, तो उसने विलेज हेल्थ गाइड का कॉन्सेप्ट दिया. ओके. बैनिंग ऑफ प्राइवेट प्रैक्टिस ऑफ द डॉक्टर. ये काम तो कोई जंगली ही कर सकता है. डॉक्टर की प्राइवेट प्रैक्टिस बैन करेगा तो मैं तो जंगली बोलूंगा ना. इफ समबडी इज बैनिंग द प्राइवेट प्रैक्टिस ऑफ डॉक्टर, आई विल कॉल हिम जंगली. So that is why banning of private practice is governed by Jangalwala committee. So the idea is, what I'm trying to tell you over here is that whenever you are reading, go with the smart study, identify that where you are likely to forget, and what you are likely to forget. Facts are forgettable. Facts are forgettable. So develop the logic for the facts so that you can remember them for a longer time. And so that you can remember them for a longer time. So this is a very simple aspect that I wanted to tell you. Okay, I'm not touching on to this. Okay. This how to mark the answer in an MCQ paper if you do not know the right answer. I think we're gonna take this topic slightly later once you are into the preparation. Okay, so I'm not taking up few ideas of this, but I'm gonna do this. Now, how many questions should I attempt in the NEET? This is another question that I'm gonna take later once you are almost in some part of your preparation. But now I'm gonna talk about this. Sir, should I write mock test? Answer is yes. Sir, when? Again, from first month of your preparation. Again, from first month of your preparation. Sir, this is where you are differ. I have attended lot of strategy sessions and most of the people have said the exactly same thing that you have said just till now. But these people say that you should write it towards the end of the preparation. I said no. Please start it from the first month of your preparation. Initially go slow, slowly increase it. From the first month, we're gonna write one test per month. One test per month. And as the time is gonna pass, after first quarter, we're gonna add 2 tests, or maybe after 2 quarters, we're gonna add 2 tests. Then we're gonna add 3 tests. Then we're gonna do 1 test per week, and slowly we're gonna increase it. All that I have to see in a GT, all that I have to do in a GT is, first it will reduce my anxiety of the exam. What I want is that once you are writing your INI CT exam or a NEET exam, you should feel that you're writing a GT. you will be able to give your 100% in the exam. Otherwise, I have seen people having a 80% effort in the exam because of the anxiety. So writing frequent GT will reduce your anxiety. That is the first thing that a GT will do. The second thing the GT will do is, in a GT, we are looking for a progressive improvement. Please remember, there is no magic that is going to happen that today you are getting 200 marks and suddenly you're going to get 700 marks. It will be a gradually progressive improvement. In your preparation, you have to be your better version from yesterday. That's all. You have to be your better version of yesterday. Whatever that you have read today should gives you a better knowledge in comparison to what you had a knowledge a day before that. That's a knowledge that we are looking for. I have scored, I have written a GT, I scored, let's say 70 correct. Okay, then in this month, I have done 4 subjects or 5 subjects. Now, after doing these 5 subjects, my score of the GT should have gone to 85 correct. Next month, I have done 4 more subjects. My score should go to 95 correct. And that is how slowly and slowly this score will improve. And from the 70, you're going to see that it has reached to 170. But it cannot reach from 70 to 170 immediately. That is how it is going to take stairs slow by slow. 70 to 85, 95, 170. Okay, so that is a nutshell that is happening. Okay, now what do we have for you? Now, if you are an intern and you have already read the subjects during your foundation batches, my usual suggestion for them is that you should go for a TND program. However, if you are a post-intern or if you are reading for the first time, we have launched a very, very special program this year. This program is very, very close to my heart, and this is DBMCI 360-degree program. DBMCI 360-degree program. Now, this year we are trying to guide you, to mentor you, to hold your hand so that you need not to have a FOMO. You need not to have, sir, what should I do for this thing? What should I do for that thing? We will give you a complete hand holding. Now, what is a complete hand holding? Now, we will be having your live classes. If you are in a face-to-face program, these were anyways 360-degree support program. But if you are in a city where you cannot attend a face-to-face class in a classroom, then join a DBMCI live 360-degree program. So what do you have in this program? Now, in this program, we have 2 batches that we are starting. One batch is for post-intern students and the second batch is for intern students. Okay, we're gonna try that for a post-intern, the classes is gonna be in a way that their complete year is dedicated for the preparation. However, in intern, we expect that the interns are gonna be busy with the internship in the morning hours. So their classes will be in the evening or on a day when there is a holiday. So either on a holiday or on the evening, the classes is gonna be there. But it is not a ordinary regular classes. So there are multiple component to this. So the first component will be knowledge enhancement. And this knowledge enhancement will be in the form of a regular batch, which will start from 30th of April and which will end on 20th of October. Now, this will be exclusively focused on NEET PG preparation. Okay. Then after that, we're gonna give you a catch-up time so that you can write your INI-CT exam also. And after, let us hope that you get into INI-CT, but by chance you do not get a rank that you're looking for, then it will be backed up by knowledge testing again. And this knowledge testing will be in the form of a TND, which will start from 13th November and go up to the 6th February. Then in this course, you're gonna get a vibe so that your apprehension of images is sorted, which is gonna be from 5th to 10th January. So there will be a break in the TND at that particular time, so that your TND schedule is also not wasted and you are prepared with the images. And before the NEET exam, there will be a final punch. We will be revising your effective program. Almost we will be helping you with your 20th book again, when we will be starting it on a 10th of February, and by 1st of March you will be finishing it. You can call it as a one shot program or another name. So this is a complete hand holding. So now what are the things that will be included in them? So please remember, you will have your live classes, and these live classes will be workbook based classes. So you will be given a workbook for that, so that all the access of the images is available to you. In case though, we recommend that you should have a structured live class, but because of any reason you cannot attend the class, the recording of the class will be available to you for all, for one complete year. For one complete year, recording of the classes will be available. You will be getting study material. As I told you, you will be getting workbook of all the subjects. You will get medicine simplified. You're gonna get the previous year questions by the book, to the point book, and you're gonna get the vibe booklet. All right. Plus, I have realized it that lot of time what happens is that students are need a push on a daily basis. Students need a discipline. So these will be guided by me. We will be having a daily session at 8:45 to 9 o'clock, where we're gonna be talking about why you need to study today. That's all, nothing else. And a daily we will be talking about it, that why it is important for you to study today. So this will be an exhaustive program for you, where unfortunately or fortunately you will be seeing me on daily basis. You will be seeing me on a daily basis. I mean, you want to opt out, you can obviously opt out, but students have said that this has been a game changing or a life changing experience for them. You will be getting an e-Gurukul plan with it along. Advanced plan you're gonna get. You got an access of free grant test, subject wise test, post class test, cumulative test. We will be giving you daily quiz on the basis of the topic that you have covered, and we're gonna be giving this to you. We're gonna be giving you the clinical videos to understand the subject in a slightly better way. So all this is gonna be given to you. For North Indians, the video lectures will be available both in English and the English version of the app. All right. So obviously, apart from that, each and every faculty would be available to guide you, to mentor you, and to support. So what broadly is gonna be there? You will be getting your knowledge enhancement with the regular classes, all 19 subjects, perfect notes, plus TND, plus revision program before the NEET exam, plus vibe, plus access of e-Gurukul, plus access of mentorship program by me and Dr. Praveen. Access of mentorship program by Dr. Rajat and Dr. Praveen. This will start, as I have mentioned, we have two batches. We are starting, you are a post intern or you are an intern, 30th April, and we will be finishing it by 20th of October. Then a fast track, then a Y program, then a revision program. Irrespective whether you join or you join any other area, once again I am saying the single most important thing that is needed is this D of PhD, and this is discipline. And the discipline, I have realized it, comes with a structured programs. It is slightly difficult, but you can get it without a structured program, but it is relatively easy to get this discipline with a structured program. Apart from this, if you think that we can help you out in any form, in any way, do let me know. I will try my level best. Whether you are a DBMCI student, whether you are not, if you think that I can help you out in any form, do reach out to me, and I'm gonna try my level best to help you, to support you, to guide you in the best possible way that I can. All right, so that is all, guys, from my side. Please let me know that if you have any doubt, anything that you want me to tell you, and I would be happy to explain that. Okay, so DBMCI, you can get the details of this on any of our social media handles, or you can fill the form that is already there as a pinned message to this particular chat, and the team is gonna reach out to you. We're gonna try our level best that DBMCI remains as a single platform to address all your need for a PG medical entrance exam. eGurukul 5.0 will be launched after the NEET exam. After the NEET exam, we will be launching it. Is it necessary to do the custom modules? देखो, पहले जब custom modules नहीं होते थे तब भी लोगों का selection होता था. It's as simple as that. All right. Now, more number of questions you do, the better it is for your preparation. But the gold standard for getting a rank is previous year questions. Previous year questions. If you can add it with QBank by doing the custom module, it will gonna be beneficial. It is gonna be beneficial, but not at the compromise of notes, previous year questions, and GT. That is what I'm gonna say. Okay, chalo guys, that is all, and thank you for sparing your time. It's always good to talk to you, to speak to you, and to guide. Even if life of one student changes every day, I feel that that day is worth. So I assume that a lot of you will be getting benefited from these sessions and these classes. Please let us know if we can do anything else for you. All right, chalo, take care, and may God bless you all.